Thank you very much, and thank everyone for being here today. This is absolutely a special event, and on behalf of Brother Ronald and the entire Ministry of Care and staff, we want to welcome you. We appreciate the fact that Christiana Care allowed us to host this event, and we're also recipient of one of the grants, and we are so excited about that possibility. It will allow our shelter staff, emergency shelter staff, to train our staff. As you know, the folks that we come into emergency shelter these days are more difficult with a lot of different issues. So the fact that we are a recipient of one of these grants, we are so excited. We are so excited for having all of you here for the outstanding work you do. So thank you for being here, and I'll turn it over to Katie.
Thank you, John. Beautiful setting. And now I'm very happy to introduce Bettina Riveros, our Chief Public Affairs Officer, Chief Health Equity Officer of Christiana Care.
Thank you so much. Thank you so much, Katie, for all your work to pull this together. And a giant good afternoon to everyone. We're so grateful to everyone here today. And thank you to John Bates and the Ministry of Caring. We are grateful to you for hosting us. This is a fantastic event. It is filled with light and possibility and positivity. And that's something we all really need in these challenging times. So we are grateful to you, and we're thrilled to be back here with our Community Investment Grant event. We are also very grateful to our elected officials and for their representatives that are here today. I know we have Jacob Wasserman from Senator Lisa Blunt Rochester's office. We also have Brian Short from Congresswoman Sarah McBride's office. I know we may have somebody from Senator Coons's office, and we also have Councilwoman Michelle Harley. So grateful that you have come as well. And if there are any other officials here, please identify yourself so we can welcome you individually as well. All right. Oh, thank you so much for being here on behalf of Senator Brown and the Wilmington Hope Commission. So really grateful for that. We all need to partner, work together, and partnering with our elected officials is so critical. Today is a very special day, as we're joined here by an amazing group of community partners who are collaborating, really partnering with Christiana Care and with each other to improve the health of the communities that we all serve together. True partnership is really at the heart of this work and our service to our community and our neighbors. We're going to hear soon from some of these organizations about the great work that they're doing, but I'd like to kick off the discussion today where we always need to start, and that's talking about the why this work is so important. We are a nonprofit health system. Since our founding over 100 years ago, I believe in 1888, Christiana Care has been mission-driven, focused on our charitable mission to serve the health and well-being of everyone across the communities we serve, and really grounded in that mission. We often say our mission is simple: we take care of people, and we take care of people every single day. Quite a lot right now. Our hospitals have never been this full, so stay healthy, everybody. So in that mission, we are driven to improve the health and well-being of every person across all the communities we serve. And that is at the heart of health equity, a mission and a commitment to health equity that we are doubling down on and committed to continuing forever. Christiana Care provides, as you know, exceptional high-quality care. I heard from some people today about the care they've received. And yet, even with that high-quality care, there are members of our community that have barriers to achieving their best health, to getting to those best health outcomes. And we still have disparities in health outcomes across socioeconomics, across race, across ethnicity. And why is that? We know that we can deliver really high quality care, and we do that every single day. And we also know that, some people say 20% of a person's health is impacted by traditional care. Doctor's visit, urgent care, hospitalizations, different interactions with doctors and nurses in the health system. The other, roughly 80%, is determined by other things. It can be our genetics, but it can also be the reality of the environment in which we live. The environment and the reality of the environment in which our neighbors live, the communities they live in, their access to food, to transportation, to housing. And we often refer to those things as the social drivers of health or the social determinants of health. But we need to be real about that language. You can't get better if you don't have a safe place to heal. You can't get better if you don't have nutritious food to eat. You can't get better if you don't have any way to get to the doctor. We recognize that to eliminate the disparities in health outcomes between the city of Wilmington, where we are right now, and the streets of Wilmington, and everyone living here, and the winding roads of Greenville, a disparity in life expectancy of at least 16 years, that we need to double down on our commitment to health equity and accelerate progress in that work, and accelerate progress in the social drivers and barriers to great health for our community. And to do that, we are committed, we are all in and committed to do that work. That is our mission, for every person in our community to achieve their best health. And we need partners in this work, and that's why we're here today. We are not, at ChristianaCare, the foremost experts on housing, like in Milford, right? Or on hunger, or on education, or economic opportunity. We're thinking about how we can support great jobs so that people can be lifted out of poverty. But we are committed to supporting that, supporting economic mobility for every member of our community, providing the opportunity for workforce training, to build our workforce, to provide the care of the future, and lift up those families and those people who then can have a stable job and can provide for their family and access the health care that they need and get to that better health. We know that we can bring our health expertise, our high quality care at ChristianaCare to these issues. And we need to partner and, with all of you, provide the resources, the funding, the connectivity, the expertise to enhance your ability to make an impact in all the areas in which you excel, and to serve the members of our community that we all need to serve. ChristianaCare is empowering and supporting our nonprofit partners, all of you, so you can help meet those needs and work with us to improve that patient health and really get to healthy communities, healthy neighbors, and a healthy Delaware. And that's our ultimate goal together. And that's what we at ChristianaCare are committed to doing. Each of the recipients today, and there were a lot of applicants. There are 25 recipients of these funds. There were over 80 applicants. So you should feel, right, that that it was competitive. Someone was asking me. It was a competitive process. There were scoring and grading and ranking and all kinds of stuff. And Katie had spreadsheets she showed me. So you all rose to the top. And we are thrilled to support you. And as our city councilwoman noted, there is a lot of need out in the community. So we will support all of you. And we, as a community, as a state, need to come together and provide support to all the rest of those organizations out there. Each of you is making a significant and important impact, really positive impact, by addressing health challenges, food insecurity, which is hunger, right? Housing insecurity, homelessness, environmental health, the air and water and earth that sustain us, and we need those to be healthy too. At Christiana Care, we are honored to be joining forces with all of you, the 25 organizations, to provide more resources so that you can help those who need the most help. And it is another way that we at Christiana Care care for our community. We care for your organizations, and together we can all support our neighbors and get them to better health. Over the past few years, we've achieved some amazing things with our community partners. We embedded co-responders. Think about the people that show up when there's a mental health crisis, and the police are called and everyone's worried, the family's worried. What's going to happen if the police come? I've got my brother or sister or aunt or uncle and they have mental health issues, and what will happen? So we've embedded co-responders within the Newcastle County Police Department to ensure that individuals with mental illness or substance use disorder receive the resources they need in that response, rather than just becoming involved in the criminal justice system. We expanded this to include the Wilmington Police Department last March, and in December with the Newark Police Department. With the generous support from Barclays, remember I mentioned that we all need partners, that we are committed, you are all committed, we know the state is committed, we know our federal congressional delegation is committed, we know our city and county are committed, and our other organizations throughout Wilmington and Delaware. We all have to come together, bring our resources together. And another example of that is the generous support from Barclays. And with that, we offer mobile health services, a primary care practice on wheels at community locations where access to health, as you can imagine, can be challenging to our neighbors. No transportation, lack of trust, we need to bring our health to the community and make it more accessible. In partnership with Unite Us, we established Unite Delaware, a social care referral network available to community organizations at no cost, allowing us to address those other needs that people have so that we can clinically work with our patients, ask them about what they need, and then connect them to the resources that will help to tear down those barriers to health. So in 2019, pre-COVID, maybe it's called PC now, we established the Christiana Care Community Investment Fund to support our community partners in their efforts to improve health in the communities they serve. And this was really an exciting time because we had done a lot of community support, but we did it in a way where we could say, we're doing this, we're going to keep doing this, and it's not just a one and done. We want to partner for the long term. To date, Christiana Care has provided more than $5.6 million to 64 organizations. And that's been a great investment. Thank you. And that is an honor for Christiana Care because we come with humility to our partners, to our community. We listen to their needs, and I'll talk about that in a moment. And then we invest in the partners who can address those needs. And that has been the process. And unfortunately, Katie Coos does a great amount of work to lead our community benefit work. And that is part of our community benefit work and our investment to really address and get to better health. These investments address, again, the $5.6 million to 64 organizations. I'm getting back on track here. Those investments address critical social, behavioral, environmental health issues, all with the goal of improving well-being, improving health outcomes, removing barriers to health, and this will strengthen the health of our communities. We expect it to improve health outcomes, to improve our population health work, and ultimately to help us in our commitment to also drive affordability of healthcare for businesses, for government, and every member of the community. It all comes together, and we need to partner to get to better health, to get in front of the emergency room visits, to get to better health, remove those barriers, and support individuals in their journey to good health. Our investments are guided by the needs of the community, as I mentioned, as a nonprofit health system with a mission of service, as I talked about. Christiana Care undertakes a comprehensive community health needs assessment every 3 years. We work with a wide variety of community partners. We go out and present to them. We work with, we've had youth involved, youth groups involved. We had great sessions with the Hispanic community. That was fantastic. So we're out there, and I don't go, like, there are other people that go. Everyone needs to give us all their insights. And I always want to go, and my team tells me, you shouldn't go, Bettina, so that's fine. So from that assessment, we listen. It's that listening. We all have to listen. We can't just do what we think the community needs. We need to listen to the community, and then the community can tell us, this is our life, this is our environment, these are our barriers to health. And let's partner around those. And that community health needs assessment is our process to do that. We do that assessment, we listen to the community, we then develop a community health implementation plans. Both of those documents are on the Christiana Care website. And that community listening then guides our priorities. Today, we're excited to celebrate our 2025 Community Investment Fund recipients and a $1.6 million investment in 25 nonprofits. It is exciting. These 25 points of light present here in the room. That investment of $1.6 million in 25 nonprofits across Delaware, and also we have some in Maryland as well. I'm pleased to announce this year's recipients. Again, we are humbled to partner with you. We are grateful for your commitment and service to everyone, and we know we can't do anything alone. So us working together is what we need to achieve. As I read the names, please stand briefly if you are here representing one of those organizations, and then sit back down. And they said right here, I kindly ask that we hold applause until the end. Let's start, it's alphabetical. AIDS, Delaware. I'm going to try to hold my tongue, which is not really my natural sense. Black Mothers in Power. Great. Boys and Girls Club of Delaware. Children and Families First of Delaware. Claymont Community Center, Brandywine Resource Council. Delaware Center for Horticulture. Delaware Futures, Inc. Delaware Nature Society. Care Doula. Healthy Food for Healthy Kids. Excuse me, Healthy Food for Healthy Kids. So many of you I've worked with in the past, so it's really exciting to have everyone here. Jefferson Street Center. Latin American Community Center. Milford Housing Development Corporation. Ministry of Caring, our wonderful host. ONCOR Coalition. Our Daily Bread Dining Room of MOT. Project New Start.
They had an unfortunate illness, so they couldn't make it. They're wonderful partners.
They're wonderful. I got to go to the Project New Start graduation. It was amazing. Ray of Hope Mission Center. St. Patrick's Center. The Resurrection Center. Voices of Hope. West End Neighborhood House. West Side Family Health Care. Wilmington Hope Commission. YMCA of Delaware. Did I miss anyone? All righty. That's dangerous. Maybe somebody showed up and they said, we have to get a grant too. So, I'm gonna tell my husband I gotta laugh. All right. Let's have a round of applause for these amazing organizations. You're all making a tremendous positive impact on health. These initiatives, selected for their strong proposals, 25 out of over 80, and alignment with community needs identified by community members, will be implemented in the upcoming year to maximize community impact. Your work targets the social drivers of health. As I said, that's kind of this term I've never really liked: hunger, homelessness, community safety, environmental factors, air, water, earth. They target those issues and the non-medical factors that influence health outcomes and that drive whether people get the best outcomes they can achieve. They include access to education, job opportunities, and improved income for all, access to nutritious foods and opportunities for healthy physical activity, access to stable housing, and a healthy environment, including safety from pollution and natural or man-made disasters. We're now going to hear briefly from a few of the organizations who received funding this year. You'll share a little bit about who you are and what this funding will enable you to achieve. But first, I'd like to share a moment of gratitude. Thank you to all of you for your partnership, your insights on what the community needs to get to better health, your dedication to serving our community and making a positive impact on health. You coming together, showing up and serving everybody is what will drive improved health in our community and reduce that disparity in health that we are committed to achieving, the health equity that every person in our community deserves, and the disparity in life expectancy between here and a couple miles away. That is the work that we all are committed to doing, all of us together, that we are all committed to doing for the good of our community, and we are incredibly grateful to all of you for doing that work together with us. So thank you. Let's join another round of applause. I'm going to now turn it to Katie Coombs, Christiana Care's Community Benefit Program Manager, who will serve as our MC. And thank you, Katie. And thank you, everyone. Whoops.
Thank you. And I am going to turn it over to Jamia Redding, the Executive Director of Housing at the YMCA of Delaware.
Thank you. Good afternoon, everyone. My name is Dr. Jamia Redding, and I serve as the Community Executive Director for Central YMCA residents, where our mission is to promote strong communities, foster healthy living, and empower youth. The Y is committed to ensuring that the 180-room unit property that we have remain affordable and accessible to those who are in need. At the YMCA, my team and I work tirelessly to connect the men that we serve to supportive services necessary to improve mental health, physical, and financial well-being. The affordable housing, as we all know, the affordable housing crisis is affecting more Delawareans now than ever before, and the YMCA stands ready to provide relief to those in need. For nearly 100 years, the Central Y, located in the heart of Wilmington, has provided safe, clean, and affordable housing to men. Today, our residents include substitute teachers, in-home care providers, veterans, mental health professionals, bus drivers, and more. We house brothers, uncles, fathers, sons, grandfathers, many whom will be homeless without the YMCA. We have established many partnerships and accomplished a variety of goals in this year. One, which is including the Christiana Care investment, community investment funds. These funds will help us to continue with serving our residents and including our famous crockpot class. We have a weekly crockpot class provided to our residents where we provide, we have an instructor who comes in once a week, and they make desserts, they make food, an entire dinner in a crock pot. And what we do is everyone who comes to this program, we provide them with a crock pot. In the summertime, we even do like creative smoothies, healthy smoothies. So they get a crock pot, they get a smoothie, a blender. But for all the ingredients that we have for our crock pot class, we provide them with those ingredients. So in the crock pot class, they make everything and they're able to take those ingredients back to their room so if they want to do it again. So we're very excited about that. So thank you again, Christiana Care, for giving us the opportunity to continue with this program. And another huge partnership that we just established is with Delaware State Housing and DSAM, because we've been approved as a landlord for their SRAP program. So this program will also allow us to offer the viable housing solutions for those unable to pay utilities or thrive in a community-oriented setting. I just want to thank you again for this, like our crockpot class, and just our community engagement has continued to grow. And this is one of the things that I would say that our guys look forward to every week. We're just adding evening class once a month, so our guys that do work or have activities and programs that they have to attend during the week or during the day, they're able to engage in this great program as well. So thank you again, Christiana Care.
Hi, good afternoon, everyone. I'm Joanne McGeoch. I'm the new Executive Director for the Delaware Center for Horticulture. I just wanted to start by saying, first and foremost, how meaningful to get a grant from Christiana Care is for our organization. It's a very uncertain time for all of us in the nonprofit sector, and certainly getting your support and your endorsement of our programs means so much, so thank you. DCH has been doing work in the community since 1977, and we really started with a handful of volunteers from the Garden Club of Wilmington that set out to do community greening work in the city of Wilmington. That seed was planted, and now almost 5 decades later, we have grown to be quite robust. We look at our programs as really having 4 pillars of support. So community greening, community forestry, which is reforestation efforts in the city of Wilmington, primarily in partnership with the city, urban agriculture, and workforce development. And I'm going to talk really briefly first just about those programs before I dive into what Christiana Care is supporting with those grants. Right now is a really exciting time for us because we're in our recruitment process for our workforce program, which kicks off in March. This is called Branches to Chances, in which we train justice-impacted and unemployed adults in greening initiatives. So they learn how to grow food at our farms, they learn how to plant trees and care for them, they learn how to tend to our 22 public landscapes, which are our greening programs. They're all outdoor classrooms. And then we place them after they graduate in the program in jobs. And these are oftentimes industries that are looking for skilled workforce. So we're really providing a second chance opportunity through these training initiatives, and these sites become really the classrooms in which they learn. The program itself that Christiana Care is supporting has a very ambitious title. So it's to improve community environmental health through our workforce resiliency, and how we aspire to do that. We have 2 farms. longstanding farms in the city of Wilmington, one of which was the very first urban farm in Wilmington, E.D. Robinson. It's located on 12th and Brandywine. And that is named after a community activist, Eric Robinson. And at that site, we primarily work with the residents who are the beneficiaries of the produce that's grown there. And then we also have partners with organizations that are providing other services to the community, including Teen Warehouse and Kingswood Community Center. We also have a community garden at Sherman Street, which is a long-standing place where local residents will have a little plot where they can grow their own produce. And that was established in the 1980s through a land grant program with the city of Wilmington. And over time, you know, our involvement at that site has ebbed and flowed, certainly as residents would take advantage of those community gardens. In this last year, we really set a focus to do more outreach directly with the residents surrounding these farms. So the farms became really kind of the point of contact, or the place where we can engage with community residents. And this grant will actually support our efforts to continue to deepen those connections. As you know, Wilmington is known as a food desert, so our efforts are a small part in many of the great work that all of you are doing here in this room to provide healthy food access to people that really need the help. We also work in partnership with a lot of great community organizations, Westside Grows, Delaware Nature Society, all of us that work together in these spaces. And we also help with a coalition, the Urban Food and Farm Coalition, which connects some of these great organizations doing similar work. This funding will, in addition to supporting just growing the healthy food, we also are going to be trying some cooking demos this year on site. So this is something new for us. Traditionally, the produce that we grow, we would distribute to residents that stop by the farm. This year, we're going to be doing some pop-up programs that include demonstrating how you can use these produce and the ingredients, including herbs, in creating really wonderful recipes that help support our health goals. So overall, I just want to say thank you again to Christiana Care for your generous support, and for also working with organizations that have boots on the ground, doing the work every day, and supporting our efforts. It really means so much. We look forward to sharing our success with you in the coming months and year, and thank you again.
Thank you, Joanne. And last but not least, we have Cynthia Pollard, co-leader of Women and Men at the TRC Food Pantry.
Greetings, everyone. It is great to be here with you all today. Isn't today just wonderful? I mean, let's give ourselves it's a wonderful day. It may be a little gloomy outside, but the sunshine is certainly in here today. On behalf of Bishop S. Todd and Pastor Cleo Valina Townsend and the Resurrection Center family, we want to say thank you to Christiana Care and express our gratitude. We are just so grateful for your support. Through the Christiana Care Community Investment Fund, we are able to do this work, and we just want to say thank you. The Resurrection Center was established in 1892. We are a faith-based organization, and our purpose is to serve as liberating agents in the midst of the world. We present Christ, prepare his people, perform works, and persuade the world. In performing works, the TRC Outreach Center serves Emmanuel Dining. Most of our volunteers were actually there today because we actually serve on the 6th of each month. We provide monthly meals to help alleviate Delaware's hungry. We also serve with Diamonds and Pearls, providing weekly AA substance abuse meetings for those who are in recovery. LAMB, that's our Loving Arts Ministry, where we provide advocacy and foster care for children. And last but definitely not least is the TRC Food Pantry, which I'm a part of. And we provide healthy, non-perishable food. And now Christiana Care, thanks to you, we're in year 2 of providing healthy, fresh fruit and produce. Our TRC Food Pantry and Fresh Produce Initiative is enabling us to increase food security and potentially impact present and future individuals' health of individuals by providing nutritious, fresh fruit and vegetables. Now, you might think, Cindy, broccoli, green beans, we get giving it out, we get people having a need, but we kind of don't get the whole impact thing you're talking about. So please allow me to put a face to that statement. There's a gentleman who comes in on a regular basis. And one time he came in and it was close to the closing hour. Most of our green vegetables were gone. We still had some things left. But he came in and he was really disappointed. And he said, I'm just tired. I come here not because I want to, I have to come here. I can't afford fresh fruit. I can't afford produce. I'm a diabetic. And my doctor says, I have to eat like this to preserve my life. If I don't eat like this, I'm not going to make it. That's the face, that's the backstory. When they come through the doors, we don't always hear those stories, but on this particular day, out of his frustration, he sat down and he shared. That is the work that we do. These are the people that we serve. And we may not know all of their backstories, but what we do Sunday after Sunday on Tuesday evenings is welcome people in to the TRC Food Pantry. We're open on Sundays 9 to 11, Tuesday evenings, and by appointment. This year, we are striving to continue to share the benefits of fresh produce with our neighbors while increasing our goals 10 to 12%. Now, we had planned a big marketing program to do this, but the economy is actually doing it for us, and people are coming in. We haven't had to PR, we haven't had to do anything. The numbers are already up. We're going to have 2 to 3 Fresh Produce Fridays in the community. This is a bulk distribution event where we go and we place ourselves in libraries and in community centers, and we let them know, hey, there's going to be a Fresh Produce Friday at the Resurrection Center. We sign people up, and we normally have 200 plus people that show up for these events. So we're looking forward to doing this again. We will continue to serve 150 households both at Christmas and also at Thanksgiving. We're going to continue to serve the school that we take care of. We take care of 12 families at one of our local schools. Those numbers tend to increase towards the end of the year, but we are faithfully doing that. And this year we introduced something called our Try Me bags. We wanted to make sure that people would start to try different types of fruit and vegetables. So once a month we have a Try Me bag. We put a different, fruit or vegetable in it. We sometimes will have the meal actually prepared so that they can sample it. We also let people know this is how you cut it. So people may not know what a delicata squash is when they walk in, but they'll walk out knowing that, hey, this delicata squash, if you put salt on it, can rival any potato chip out there. If you put a little cinnamon on it, it tastes like dessert. So we're hoping that people continue. People are starting to like this. We also are providing recipes and putting most of the ingredients that they would need in those bags. So they're enjoying that. We also have a brown bag medicine review where pharmacists come in and they ask what meds neighbors are taking. So you bring your medicine in, you bring it in a brown bag. There are 3 pharmacists that are on site within our faith community, and they sit down and they go over those medicines and they talk to you and they recommend what you should be eating or what you shouldn't be eating. And they go as far as to let the pantry folk know, the citrus is good for some folk, not so good for people that may have diabetes. So every now and then, make sure you guys go heavy on the berries. So this is information that, we're looking forward to and really excited about. We want you to know that because of the work and sponsorship, we are starting to see the emotional impact that this is having on the community. There is an emotional impact tied to this. People are starting to tell friends and family, hey, on Sundays you can go over to the Resurrection Center and you can get fresh fruit and produce. People used to come in only for the non-perishable items, but now they come in and say, you know what, I got enough canned goods at home. I'm doing pretty good. You all have stocked me up. We've also gone to Lutheran, so we've gone to other folk in the community, but we just need the fresh produce. And so it delights us that people are coming in and requesting the fresh fruit. So again, thank you for all that you do. Thank you for supporting us. It is because of you that we are really able to get this work done. So thank you.
Thank you so much. And now I'll invite Bettina back to close us out.
Wow, really tremendous, tremendous stories, and that's just fantastic to hear the tremendous work that you're doing, and the three of you multiplied by every person in this room as well. You've shared from the YMCA, Delaware Center for Horticulture, from the Resurrection Center, all the work that you're doing, not just in the specific areas you talked about, but building community, what you mentioned there just now, building community, and that's part of how we get to better health. We know that the burden of chronic disease, the need for food, the need for housing and homes, the need for economic opportunity is tremendous. And I talked about that at the outset. Providing food and housing is not only a human right, it is a moral imperative, and everyone here is working to address those issues and others that can drive better health for every member of our community. I am but one. Everyone was, you can look at me, but I am representing 14,000 caregivers strong at Christiana Care, who every day are showing up, ice, rain, snow. They're tired, they're coming in and taking care of all members of our community, doing everything we can in service. So I am humbled to represent those 14,000 caregivers, to share with them how we are partnering with all of you. And we need and appreciate the boots on the ground that you're providing and the service to our community. So let's do great work together. There's even more work to be done. We will all be challenged. This is a hard year already, and we are strong, we are leaders, and we will persevere in our commitment to health equity for every member of our community and addressing all of the needs of our community. So our community, with the support of Dr. Emmanuel Mensah, our Chief Medical Officer at Wilmington Hospital, so that every member of our community can achieve their best health and we can end disparities as we know. We are strong, we are leaders, and we are working together. So thank you so much. Please collaborate, work together, be stronger together. Thank you.